Sorry about that delay. We have had some technical issues with trying to get Dr. Birnbaum on the line, and we will follow up with her to appear or provide a submission at another time. But for Dr. DeWitt, we thank you for your time today. If you have undertaken to provide additional material on notice, please provide it to the Secretariat as soon as possible and no later than 5 p.m, 30 June 2025 at your local time. Thank you very much.
Thank you so much.
Thank you. I now welcome representatives from the Australian Academy of Science. I understand that information on parliamentary privilege and the protection of witnesses giving evidence to Senate committees has been provided to you. For the Hansard record, will you please state your full names and the capacity in which you appear today?
Dr. Hayley Teasdale, Head of Science Advice and Policy at the Australian Academy of Science.
Thank you. For those online?
Hopefully you can hear me. I'm Professor Oliver Jones. I'm a Professor of Chemistry at RMIT University.
Thank you.
Dr. Nathan Kilah, Senior Lecturer in Chemistry, University of Tasmania.
Thank you. Now, do you have an opening statement? Thank you.
Good morning, Senators, and thank you for the opportunity to contribute to the proceedings of this committee. My name is Dr. Hayley Teasdale, and I'm the Head of Science Advice and Policy at the Australian Academy of Science. My team at the Academy has been supporting scientists involved in many consultations and conversations and negotiations over a number of policy issues for many years. The Academy is an independent science advisor to government with the purpose to inform public policy and deliver better outcomes for all Australians. As we said in our submission, and as the committee is aware, there's a growing recognition of the potential environmental and health impacts of PFAS, with the PFAS concentrations detected in drinking water, soils, biosolids, and plant and animal life. The longevity and stability that make them useful in certain applications also make them persistent in environmental and biological systems, and difficult to identify and difficult to remove. This is clearly an area where science is a useful addition to the policy-making process, and the committee has commendably already heard from experts in a number of fields. At the risk of stating the obvious, science can only provide advice based on research that's already been done. Where there are gaps in knowledge, it's because we haven't yet undertaken the necessary studies. More than that, though, PFAS monitoring, impact assessment and remediation are at this transitional point between academic research and regulatory science. And that may or may not lead to some unsatisfactory answers along the lines of, well, we're not sure yet, and that hasn't yet been determined. However, academic research is directed at generating new knowledge by investigating research questions. And then we're at this transitional point between that and regulatory science, which is not so much concerned with generating knowledge, but providing certainty for regulatory decisions. So between them is this transitional period that we find ourselves in, where the questions are needed to inform eventual regulations. And these are questions that your committee has been asking, like what is a safe level of PFAS exposure? What does that look like over a lifetime? What are the long-term clinical impacts? What technology options are available for remediation? And some of these questions do have answers drawn from existing research and policy and technical responses locally and internationally. However, some of them don't yet, so we're still relying on that fundamental research. This transition is marked by a deliberate shift from inquiry-based research to a more comprehensive, coordinated approach to building the evidence base. This is why our submission called for a strategic national monitoring program. It's not intended as a generic call for more funding for research. Rather, it is an investment in government scientific infrastructure to fulfil government responsibilities towards its citizens. The experts I have with me today are Professor Oliver Jones, whose expertise is in analytical environmental chemistry, tracking pollutants through environment and their possible effects on biological systems. And Dr. Nathan Kilah, who's a synthetic chemist whose work has led to chemical sensors for environmental pollutants. This represents a focus on the chemicals in the environment, and that's where we're best placed to answer questions today. But for any questions outside of our expertise, the Academy is very happy to convene its fellowship and additional scientific experts to answer questions to inform the committee's deliberations. So if we're not able to answer a question today, or if at the end of your hearings you find yourselves with any knowledge gaps requiring scientific input, the Academy is very happy to convene the relevant expertise to assist the committee. Thank you.
Great, thank you. I'll hand over to Senator Pratt for questions.
Thank you very much. I'm struck by what you said around regulatory science versus academic science. We heard from an academic that's contributed to a great many regulatory outcomes as our last witness. I'm not sure if you were able to catch some of her evidence, but it really highlighted the need for that precautionary approach within regulation, and that we're not just looking for a toxic threshold, we're actually accepting the science that this is carcinogenic and can affect the immune system and have a whole range of different outcomes, and we need to regulate for that. Perhaps you could respond to that. But Chair, I'm also mindful, are other witnesses giving opening statements as well? Do we want to hear from all of them first, or?
No, just the one opening.
Okay, well that's great. I'm happy to therefore put that question to you, Dr. Teasdale, or the other witnesses, to see who's most relevant to answer it. Yeah.
Sure, I might begin and then hand over to my fellow witnesses. I won't speak to regulation as our remit falls more into the fundamental science that sits underneath that. So I might just say that building that evidence base that's consistent and reliable and is able to create informed decision making based upon that, whether that's regulatory or other, is very critical at this point. Nathan or Oliver, would you like to speak to this?
I'm happy to speak to you, if that's all right, Nathan. Senator, thank you for the question. I think it's an important point. The only thing I would say is that we need to be cognizant of the difference between mere detection and exposure and the level at which causes harm. For example, if we look at alcoholic drinks, we know that alcohol is a class 1 carcinogen, which means we're sure it causes cancer at certain concentrations, but we don't necessarily regulate that nobody can drink alcohol. We know that UV light outside can cause skin cancer, which is why we wear sunscreen in summer, but we don't necessarily wear it all the time in winter. But it's not the case that you'll get cancer as soon as you step outside. There is a dose-response relationship. So I think we need to understand, yes, PFAS are a problem. It depends which PFAS we're talking about. And we know that in certain cases, some of them can be harmful. But before we regulate anything, I think we need good understanding of exactly where those risks are. And I accept the precautionary principle is a good place to start, but we also have to remember there's no such thing as no risk in our daily lives. If you take a car to work, there could be a car accident. If you take a plane, there could be a plane accident. So we have to sort of think about what level of risk are we willing to accept in these things.
But if we can't ascertain that risk and we know there's a risk, what are the implications, therefore, for regulation? Like, for example, with the last witness, we were discussing, in response to the Chair's question, about whether these chemicals are regulated as a single class, knowing that they all have at least one vector, but many of them a great many more vectors for cancer and other toxins. And in other regulatory jurisdictions, they've therefore made the decision to treat them as a single class, as opposed to the kind of approach where we're seeing them separated out. So, for example, the Health Department's website federally currently says there's 2 types of PFAS that are really recognised as contributing to these 2 specific types of cancer, but they're quite uncommon in Australia. So what are the implications of seeing a statement like that versus the decision of other jurisdictions to treat the chemicals, you know, as a single class for regulatory and also assessment purposes? And how would we go about asking scientists such as yourself to say, okay, can you go away and look at this problem from an Australian point of view to see what the best fit is for us?
Thank you, Senator. It's a very interesting point, but I think the problem with listing PFAS as a class is how do we actually define PFAS? There are a number of different definitions around. So if we go with the original, I think 2011 definition, it gives you about 7,500 compounds. If you use the OECD definition, it gives you up to 7 million compounds. The US EPA has another definition, so does the Canadian Environmental Protection Agency, and they don't all overlap. If you use the OECD definition, many pharmaceuticals are PFAS. So Prozac counts as a PFAS under that, several lipid-regulating drugs, and I believe one anti-HIV drug. So if you're going to list everything, say, well, we'll just regulate all PFAS, there needs to be a clear definition of what we're actually going to define as PFAS for that, because otherwise you start to regulate things that actually people need. And it becomes also overlapping agencies are involved. So you might have the Environmental Protection Agency for environmental contaminants, but if you start to regulate things that are also drugs, then you need to bring in food and drug regulators. So it gets very complicated, and you may end up potentially regulating things that didn't need to be regulated because they weren't a problem or already regulated in the case of drugs. Many pharmaceuticals are fluorinated just to extend their biological half-life, so they last longer in the body and have their therapeutic effects for longer. And many fluoropolymers are widely used in the medical industry already. So it's an interesting idea, but I think it would need to be thought out very carefully so that unintended effects didn't cause more harm than good.
And it might well be that I've misunderstood the class of chemicals that they've put together, but I guess the problem is if the Department of Health comes back and gives me a similar answer, it's very hard for me to interrogate that to say, okay, well, I want you to take a really strong precautionary, proactive approach to this. Where do you draw the line? Can you please look at these particular jurisdictions that have gone further, for example? I guess it's hard for politicians and policymakers who are responding to the community's concerns to be, we need to be really confident that we're not just getting a bureaucratic answer back from regulators, and that that level of science and community concern is reflected in the way we regulate and implement.
It's a tricky point to be in. I might just talk about science advisory mechanisms briefly, if you'll indulge me. We were looking, the Academy has advocated for some time for a model similar to the United Kingdom's Office of the Parliamentary Office of Science and Technology for this exact kind of use case where you are trying to interpret scientific information so that you can advise, a Senate committee or across Parliament rather than government only through the bureaucratic mechanisms that you were talking about. But to get, be an independent convener of science advice, which is the role the Academy is filling in Australia at the moment, but this is a different model that the UK have used. And it does come to light when we look at issues like this that are highly technical. But our experts here, I'm sure, can speak more to the chemical classes as you've described.
Well, I might add one thing there. I think there is logic around regulating as a class if you're basing it on use case. So cosmetics, food packaging, I think that if you're trying to be precautionary, then those are clear places where there is the opportunity. The pharmaceutical one is a great example. The HIV treatment it's in clinical trials at the moment. it works for 6 months on one shot. And it's the persistence that's really enabling it to do what it does. And it would be very disappointing to see something that potentially is a very powerful HIV preventative fall under a banner of complete regulation. So use case is key.
Thank you. I think that's the kind of approach that we had outlined to us this morning, and we'll try and test our officials this afternoon on how it's done. Yeah.
Thank you, Senator Pratt. Professor Jones, following up on what you just talked about, which definition of PFAS do you think would be the most appropriate to use if pursuing a regulatory approach for PFAS as a class?
Well, thank you, Senator. My personal opinion is that the Buck et al. Definition, which was published in 2011, which defines PFAS as basically a molecule with a hydrocarbon chain where all of the hydrogens are replaced with fluorines, or either all or most of the hydrogens replaced with fluorines. And that's what gives you things like the things we tend to think of as PFAS, like PFOS, PFOA, etc. And it also limits the number of chemicals. You get about 7,800 chemicals under that definition, but not all of those are actually commercially created or used regularly. So I think it's something like 10% of those would be, you might find in industry and so forth. I think if you start to go further than that, then you start to end up with potentially thousands of chemicals that may or may not be a risk to the environment. Or depending on what people, the other idea would be to look at the ones that we know or reasonably suspect are actually harmful, such as PFOS, PFOA, and potentially even make a separate list of things that we know are a problem or we suspect are a problem, and start with regulating those, and then work on other ones later.
Thank you. And this is for who's applicable to answer. You state in your submission that national enforceable standards should focus on the main emission points of PFAS into the environment, including wastewater treatment plants, landfills and biosolids. Why the emission points and not the source, firstly? And won't the problem continue as long as we don't tackle the source?
Oliver, sorry, would you like to speak to that one, or would you like me to?
I'm happy to have a go if you want.
Sure.
I think the reason for that is, Senator, is the emission source. It goes back to this dose-response relationship. So if you're going to look at where people might be exposed to the highest amount, it's probably going to be at one of these emission points, such as a landfill, where you've taken perhaps PFAS-containing waste from a large area and you've sort of concentrated it into a small area. So you've gone from a diffuse source to a point source, so to speak. I take the point that, yes, if you continue to release PFAS into the environment, then you're still going to it's still going to be there. But if we want to reduce the exposure of people to the highest amount, then it's those point sources or the emission points that would be good to start with.
I suppose just to add to that, it also comes down to where monitoring is taking place and available as where you're measuring as well.
Yeah. Thank you. Also, in your submission, you stress the need for a nationally coordinated monitoring program to determine the extent of PFAS contamination across the country and resulting environmental and human risk, and inform effective management and remediation efforts. What should such a program look like?
Thank you for your question. It's a very good question. I will throw to Nathan and Oliver in a moment, who may have their own ideas. However, it comes back to my original point in my opening statement, which is really about building that evidence base. How the rollout of such a program would be for my bureaucratic colleagues, and what's possible and what would work with existing other programs that are in similar spaces. But the idea would be that we would be building up that evidence base to get a better idea of what's happening and where, to help inform future decision making, and therefore regulation if you were after that type of outcome. Nathan or Oliver?
So I think, I'm assuming the committee is familiar with the PFAS map that I think the Friends of the Earth have put together that collates different information obtained by FOIs and other sources. It would be much better to have a coordinated approach where we know that the testing has been done by standardised procedures following similar methodologies. So we are able to get a really big picture snapshot and coordination of what it looks like. So that's a great resource, and it's useful to see, but really I think that's something government should be providing through both the testing and the consolidation and availability of that information to the public.
Thank you. And I understand that the Friends of the Earth mapping is done by volunteers, so it'd be great if the government took that up. Australia has not yet ratified the listing of PFAS, PFOA and PFHXS under the Stockholm Convention. Do you know why this has not occurred yet? And what would the ratification mean in practice for this country?
So in terms of, well, the first part was why not? I don't know the answer to that. Look, ratifying this would be a step forward. This is going to be a constantly evolving list of materials. And so unless you do have an all-of-class ban with use case exemptions, there's always going to be the need to expand this list of persistent pollutants. So ratifying that would be a step forward in the sense that those chemicals would then be listed, but it is a step. There'd be more steps that would be needed going forward.
Yeah, I would add to that. I mean, obviously ratifying it is a political decision, not a scientific one. Personally, I think we should have ratified that earlier. Those three chemicals listed are three of the nastiest PFAS. We don't make any PFAS in Australia. It's all imported, but we don't, from our own research, we don't see an awful lot of PFOA. We do see PFOS and PFHXS and some PFOA, of course. But we don't have we know some of the industries that use PFAS, but we don't know all of them. So it's hard to say exactly what the implications would be, except that, of course, if you have an industrial need for a particular chemical and that chemical is banned, then you either have to find an alternative or change your process. So we have seen in the past when longer chain PFAS have been banned, we get other PFAS coming in to replace them, which can in some cases be less well studied.
Thank you. I just have two more questions, and Senator Pratt, do you have any further questions?
That was really helpful. Just let me have a quick reflection.
All right, I'll go with mine too, and then we'll see how Senator Pratt's going. How can other PFAS chemicals than those currently regulated be most appropriately covered in a regulatory approach?
So that's a really good question. I think that's probably going to be one for the politicians and the policymakers to work out. I think really we need to be on the ball with this and looking at if new PFAS come in, I think there needs to be some ecological and toxicological testing, whether that's in the lab or in a computer simulation, which are increasingly good ways of doing it these days, so that we have some knowledge about what the effects might be at least before it enters the market and potentially the environment, rather than letting it in and then trying to solve the problem later, which is what we've sort of done with PFAS.
I've got just one.
Yep. I might ask my last one and then... and finally from me, how could PFAS contamination and exposure pathways and the related risks be better communicated to the public?
I can start with that one. So there's a lot to be learnt from other risk communications to the public. The Academy of Science assisted Department of Health during the COVID-19 pandemic with the release of new types of vaccines and how we communicate the risk of some of those vaccines and comparing to benefit. The public literacy around science will be really important here. The specific risks I will throw to Oliver and Nathan, but where it comes to generic science literacy and communication campaigns. I think partnering with scientists, with linguists, with educators, with community leaders to help build the knowledge with the people that can pass that knowledge on is really critical. And our scientists are always willing to help where necessary. Oliver or Nathan, anything to add?
One thing I would add is that I think there's a real need for the similar to the exposure, the acute information for communities who are most vulnerable to impacts of PFAS, and then the broader community in terms of understanding PFAS in context. Because it is easy, and there's legitimate fears, which I can see why people get concerned, but they're not necessarily experienced evenly across the community. And so it's making sure that we have both acute information for people who are likely to be most affected, and then the general information to make sure we have an informed population.
Thank you.
Yeah.
Sorry?
Could I just add to that, Senator? That's okay. Yeah. I think it's a really important point that the risk, so toxicology in general is a nuanced subject. You have to understand the extent of the dose, the duration of the dose, the route of exposure. And in many cases, the communication around the risks of PFAS have occurred in predominantly social media, so you don't have to go very far online to find a lot of worrying stories about PFAS. But a lot of the time, these are given by people that have no experience in toxicology, no experience in chemistry, and in many cases, not any real experience of PFAS. But we don't hear an awful lot from government sources and regulatory sources. So that need to communicate science to the public in a way the public can understand and trust that information, so that we have social license to, explain the risks and people understand those risks and accept them, rather than in some cases people sort of believe that whatever the government says must be wrong by default. So I think there's certainly work that could be done in that area, perhaps by scientists, by regulators, by environmental protection authorities, for example, to explain those risks better, perhaps through community consultation events, bringing people together from different areas, industry, the public, Indigenous groups, to all come together and understand this problem, rather than it all being doing separately, if that makes sense.
Absolutely, and we've already identified a number of discrete communities that are being impacted by PFAS. We have Wreck Bay that, local doctor said is a cancer cluster, and even the community there are not aware to this day the impacts fully of PFAS on their community and their future generations. So thank you very much. I'll hand over to Senator Pratt.
Thank you. I just wanted to ask briefly in the context of the Academy's submission, which, talks about further science in monitoring, biomonitoring, clinical care and concentrations and risk communication. How are those involved in science in this area? What mechanisms are you currently using to ask government and to give direction to government on these kinds of questions? And, how is that going?
I think that's one for Oliver and Nathan, if I can hand that up.
I probably don't have a lot to add, to be honest. I haven't had much conversation in those topics. I think it highlights, though, that Senator Thorpe mentioned the Wreck Bay community and the need to make sure that we have testing available in the community and that we're doing that as part of a biomonitoring thing more broadly. Yeah. So we understand it within and so how do people how do they pay for those tests? Are these pathology tests covered by Medicare? They're not at the moment, as far as I'm aware. So there's a few things in that space. I've sort of drifted a bit off the topic of the question.
That's very relevant, given, there's conflicting advice about whether we should be encouraging people to get tested in these communities.
And that's where I think you've got to separate if someone has a concern and they're worried about their individual situation, but they're not in a position that's known, having a national human biomonitoring program, which is covered in the submission, would be a way to have that broader base of understanding of community exposure.
Yeah.
And from there, you then have a benchmark that you can compare the acute exposures that might exist within different communities.
And a Medicare exemption, a Medicare support would be a good contribution, given that most of our Medicare dollars do often tend to get spent in pathology on rich people who have more tests currently, and that, you know, the idea that there's a medical protocol here that says we don't test people for PFAS, it doesn't seem right when they're more likely to be socioeconomically disadvantaged communities.
I was quite surprised to hear from one of the representatives who spoke to the committee last week, who was a firefighter, who wasn't given occupational testing. So it's not to test out of a place of alarmism, but to understand exposure. We need data.
It sounds almost like we don't want to test because we don't want to know the scale of the problem. Yeah. Why do you think we're not testing? Is it because people think that it is are really trying to back in the evidence that has been quite prominent, that there is not a greatly lifted risk because of PFAS exposure?
So I think one of the reasons is that we all come from different exposure backgrounds, as in where have we consumed our water, what catchment, do we use cosmetics regularly, you know, diet. So the exposure route potentially for people in different parts of the community could be very different. That's not a reason not to test, but it means that when we get results, we do expect to find PFAS.
Yeah.
And it's understanding that on a bigger picture that I think will give us context to what we find.
And it's interesting to note the similarity between your recommendation and the Health Academy of Science, where they're really talking about priority research on the impact on early life PFAS exposure, which if we were to get to that would actually, I think, unpack some of those purported scientific attribution issues with attributing effects with PFAS. Thank you, Chair. And any other comments on... I've now just asked a series of questions off the back of that, so feel free to jump in if we've got time, Chair.
Sure.
Just very briefly, I just wanted to say that coordination and standardisation of testing really helps here, to be able to have comparable communities to measure against. With the ad hoc testing, the point of comparison is not always there, or you might have a result that would appear alarming, which may not be, all of those types of things. But having standardisation and coordination means that we would have a bigger evidence base to better understand what's happening in our communities.
I might just, don't know whether it's a question or a comment, but there was an academic that brought some PFAS testing kind of nodules last week to the hearing that were just like the diabetes check, a thumb prick that shows PFAS levels. I'm not sure if you're aware of that testing regime, but the one that we've known about only is the blood testing that costs thousands of dollars, and that's prohibited particularly Wreck Bay people from accessing the blood testing. So just, you know, if we talk about consistency, then how do we know which blood testing is the best mechanism to use? And have you heard of the thumb prick test for PFAS?
Oliver?
I believe that's probably something being developed. I imagine that was Dr. Clark that presented that information last week. And I know that Trajan, which is a company based in Melbourne, that's been developing this method for taking blood sampling, which can then go on to be analysed by liquid chromatography, mass spectrometry. So their method is a good way of taking a sample, but you still have to run the analysis on quite an expensive instrument. Now, saying that, most of the cost of running the sample is the analyst's time. Once you've bought the instrument and it's up and running, I mean, and they are very expensive, but they're already there in most cases. It's the time to spend, have someone take that sample, run it, and analyse the data. And I would suggest PFAS is an extremely difficult thing to test for. We're looking at things in the part per trillion range in some cases. And PFAS, they stick to glass, a lot of them. You find some PFAS even in the instruments that we use to measure them. So it's very easy to accidentally, say, double your value that you're measuring because of a very small amount of contamination. I think if you were going to use something for health testing of the population, you'd want a method that had been validated, proven, and was trusted by a wide variety of groups. So while it would be attractive to use a very quick, simple test, you want to make really sure that those results were accurate. And going back to Senator Pratt's question, the other important thing about measuring PFAS and reporting levels is to explain to the people whose the data you're giving them what it actually means. So in many cases, people have, I've seen some of the submissions where someone has had their blood tested privately and they say, oh, my blood level is 5 times higher than the background concentration of people in Australia. But if you're talking about 4 nanograms per litre and you times that by 5, you're still talking about a very, very small amount. And we don't know whether that's a problem or not. So we want to be very careful about worrying people because there will be people such as firefighters and the Wreck Bay community, for example, who have been exposed to very high concentrations that potentially may have a health effect. And the everyday person who's probably got a small, I think 85%, according to the latest data, have some PFAS in their blood. But whether that's, you don't want to worry people unnecessarily. So it goes back to communication again about what that data actually means, and having that wider knowledge about where PFAS is in the environment would be helpful to sort of relate where are the sources, where are the highest levels of risk, where can we put whatever resources we have to best use. So if you spent millions testing the blood of people in urban Melbourne, well, you might find some useful data about that, but you wouldn't be helping people in remote communities.
Well, thank you very much. If you have undertaken to provide additional material on notice, please provide it to the Secretariat as soon as possible and no later than 5 p.m. Monday, 30th of June 2025. Really appreciate you taking the time to be part of the Senate inquiry today.
Thank you, Eileen.
Thank you.
Thank you.
Thank you very much.
Thank you.